Good afternoon and welcome again to Black Press USA Live. The director of the National Institute of Allergy and Infectious Diseases, Dr. Anthony Fauci, has advised 6 presidents on HIV and AIDS and many other domestic and global health issues. In a 2020 analysis of Google Scholar citations, Dr. Fauci ranked as the 41st most highly cited researcher of all time. According to the Web of Science, he ranks 8th out of more than 2.2 million authors in the field of immunology by total citation count between 1980 and January 2020. Dr. Anthony Fauci is simply the nation's, if not the world's, top infectious disease doctor. We are privileged to have Dr. Fauci. Welcome, Dr. Fauci.
Thank you very much, Stacey. It's very good to be with you.
And also joining us, of course, is our esteemed president and CEO, Dr. Benjamin Chavis. It's always a privilege to have the boss with us.
Well, thank you very much. And on behalf of the National Newspaper Publishers Association, Dr. Anthony Fauci, I want to just say a word to you of appreciation of your leadership. We look to you for guidance. We look to you for the actual facts and the science that will help not only Black Americans, but all Americans and people throughout the world who would see this live stream, how to not only respond to COVID-19, but what are some of the steps that we need to take to protect ourselves while a vaccine is being developed. So Dr. Fauci, as you know, Black Americans are disproportionately, Black Americans and Latino Americans are disproportionately impacted in terms of the fatalities, in terms of the comorbidities that make them vulnerable to COVID-19. Just in a word, I want to lead off, speak to us, Dr. Fauci, about how we should respond, how we should act. What are the best practices that you can share with us and at this part of the journey of COVID-19? As we speak today, it seems to be the virus is spreading still across America in all 50 states. Some are up, some are down, but overall, we're not witnessing a decline. We're witnessing an incline in COVID-19. So what should we be doing, particularly the nation's minority communities, particularly the African-American community that the Black press represents?
Well, thank you very much, Dr. Chavis. There are a few issues there that I think are worth pointing out. First, to get the audience who's checking in on this to realize the extent of the disparity and the real disproportionate burden of infection and disease that the minority community, particularly the African American and Latinx community, and even Native Americans are experiencing with COVID-19. It really comes from 2 different standpoints. As a demographic group, although it's always dangerous to generalize, but I think in this case, a generalization is appropriate and true, that if you look as a group at the kinds of jobs and the economic status that minority populations, particularly African Americans, are in, it makes it much less likely that they'd have the opportunity in their employment to protect themselves, for example, by doing a lot of teleworking. And many are in essential jobs that put them out into the community in situations where it's more likely that they're going to get exposed to and infected by the SARS coronavirus 2, which is the cause of COVID-19. So on the one hand, you have a greater opportunity and risk of getting infected. But as important, or even more important, once you get infected, you have a prevalence and incidence of the comorbidities that make it much more likely that you will wind up getting a severe outcome from infection. And those comorbidities are things like diabetes, hypertension, obesity, heart disease, chronic kidney disease, and lung disease. If you look as a population of the African Americans compared to the general population, it's very clear that they have a higher incidence. The reality is that you suffer more. The hospitalization rate per 100,000 people, let me show you the difference. It's stunning and really in many respects unacceptable that it should be this way. The hospital rate for Black African Americans per 100,000 is 247 compared to whites, which are 53. In other words, it's almost 5 times the chance of getting hospitalized, even though the African Americans comprise only 13% of the population. Yet the hospitalization rate is 5 times more. So that's something that really we need to deal with. So what is going on in this world of COVID-19? And very quickly, what are the statistics? Well, when we in the United States had the big burst of infections that were focused early on in the northeast part of the country, particularly in the New York metropolitan area, which at one time actually accounted for about 50% of all of the new infections and the deaths in the United States. That started to come down, but it never went down to baseline. It stayed at about 20,000 cases per day, which is a lot of cases. And it did that for weeks to a few months. Then as we got to the attempt to open up the country again, get the economy back, what happened is that certain states did not abide by the recommendations of the guidelines of the prudent step-by-step approach of opening. And then we had a surging of cases that went up to 70,000 per day. As of yesterday, it's about 54 to 59,000 per day. So the risk is considerable. And Dr. Chavez, in response to your question, what can we do? There are some very simple things, maybe 5 fundamental things that everyone should be doing. Whether you're a state that's got a high level, a medium level, 1 is universal wearing of a mask. 2 is avoid crowds, any more than 10 people. 3, to keep your distance when you're with someone, at least 6 feet. 4, locations should seriously consider either closing bars or getting people to avoid going to bars or doing it outside, because the inside congregation in bars is clearly known to be a risk factor for acquisition and transmission. And finally, simple things like washing your hands frequently as you can, either with soap and water or with an alcohol Purell thing like this. Those 5 things are not very difficult to do. But we know that if you follow the situation in other countries and here, when you do that, you can avoid infection.
Yeah, absolutely. And Dr. Fauci, obviously, one of the things that we all have been told is to wear masks. Dr. Fauci, it might sound like a weird question, but how do you wear a mask? What's the proper way to wear a mask? And if you have yours, can you demonstrate it?
Sure. Okay. So this is a cloth mask. Remember early on, there was a shortage of masks, and we didn't want to take the masks away from the health providers who needed them. So the suggestion was made, and it works well, that you can now easily get a cloth mask. There's all kinds of cloth masks. So here's a typical, simple, you go like this, put your fingers here, go like this, and put it on. Now, when there are droplets that come onto where someone sneezes or coughs, or even droplets you may not even see because they're below the level of vision. So they may accumulate here. So when you take your mask off, you don't do this. You go like this. Easy off, easy on. And then you can then take this and wash it easily. Just wash it with soap and water or stick it in the washing machine. That is the typical mask that you can use. And it's so easy to acquire it and to put it on and take it off.
Yeah, absolutely. And Dr. Fauci, we keep hearing about the potential vaccine, but we know that clinical trials are really important. But at the same time, the African-American community has historically shunned critical trials because of fear and not really trusting the medical community. what can you say to the African American community about the vaccine or potential vaccine and clinical trials?
Okay, so Stacy, let me just make a comment about vaccines and clinical trials in general, and then the specific issue of the trust of the African American community. So right now, we are in the process of advanced development of more than one candidate vaccine for COVID-19. In fact, 2 days ago, we entered into a large phase 3 trial of 30,000 individuals based on very promising data that was done in phase 1 and phase 2 trials just a month or two ago. And we have pretty good indication that we are cautiously optimistic that the vaccine is going to work. We need to prove that, because there's never a guarantee when you're developing a vaccine. But we're going to be testing it in 30,000 individuals, 15,000 who get the vaccine and 15,000 who get a placebo. That started a couple of days ago. It will go for the next several months. And sometime probably in November or towards the end of the year, we will know whether we have a safe and effective vaccine. It's being done in the classical fashion. It's being done very quickly, but it is not sacrificing safety, nor is it sacrificing scientific integrity. Now, we hope that we will have an effective one by the end of the year, which means as we get into 2021, we're going to be wanting to distribute the vaccine for those who would benefit from it. Now, in the clinical trials, it is important, particularly for what we were just talking about a few minutes ago, of the increased vulnerability of the African American community to getting infected as well as to getting a severe outcome. So it's important in all public health to protect the vulnerable. And in fact, the African American community is more vulnerable than others. So we need to even spend an extra special effort to protect them. And you could do that with a vaccine. And the way you find out if it's safe and effective, a vaccine, is you make sure that the enrollment in the vaccine trial, that 30,000 person vaccine trial, and that's only one of several trials that will be coming online in the next month or 2 or 3, is to get a proper representation of African Americans in the clinical trial, so we could show that it works and is effective in African Americans and that it's safe in African Americans. Now then the problem comes in, what you mentioned, Stacy, because the history of the African American population with medical researching is not a very good history, dating back to the now shameful Tuskegee experiments that took place decades ago. So what we need to do is to make sure that we reach out in the community and engage the community of African Americans to explain to them and be very transparent about the safety and the potential efficacy of that. If that's the case, we want to make sure people do this with confidence. So we can't say, just believe me. We've got to get out and get community reps to be very transparent about what we are doing, because it would be a terrible shame if, in fact, African Americans stayed away from the clinical trials and stayed away from getting vaccinated and didn't provide for themselves the protection that vaccines would give them. So we understand the suspicion, but we want to make sure that doesn't get in the way of the equal access to an important intervention.
So Dr. Fauci, that's a good segue. Thank you for that substantive response. There are 50 states, 50 governors, but yet our observation, Dr. Fauci, that there's unevenness. We don't have a national policy where everybody is on the same policy page of what to do about COVID-19. Unfortunately, we have some states, some municipalities still debating whether or not you should wear a mask whether or not you should close the bars, or the some medical schools are saying maybe we should reset and start anew in terms of everybody following the same guidelines. How, from NIH, from your distinguished experience and perspective, how can we get a whole of government, not just policy articulation, but a whole of government, federal, state, local, on the same page, so that most Americans get protected, get the information, and so there's not these debates and these myths out here that we have to constantly try to rectify. So much distortions, even on social media. One of the things that we represent is the trusted voice of the Black community, and we want to make sure, as you stated, give out the accurate information in a timely fashion. What can you say about how we need to achieve a policy that everybody follows, that everybody implements, so that we can get control of the spread of this virus?
Yeah, that's a very good point, and it's not an easy situation, because in the United States, as you know, we have a somewhat of a, what do you say, it even goes beyond a tradition. It's kind of the core of how our country was built, with federalism, where a lot of responsibility is given to the individual states, and the federal government serves as support, a source of information, a source of resources and guidance. And what has happened is that because of the individual independence of some of the states, you're quite correct, Dr. Chavez, that we don't have uniformity in response. And that's not a good thing. So what we are trying to do right now is, I'm a member of the coronavirus task force, is to get a very strong message, which is the reason why I agreed happily to join you on this fireside chat, to get the message across that everyone should be doing fundamental things. I call them the big five, masks, crowds, distance, washing, close the bars, or if the state and the city doesn't want to close it, then at least stay away from it. We've got to keep hammering that home. Now, obviously, we want a consistent message from above, and I'm very pleased to see that we now have the president talking about wearing masks, where early on he did not. The vice president clearly wears a mask when he goes out right now. So I think we have a unanimity and a consistent message. So we've got to get the states to buy into that and to have the same message. A bit ago, it was almost a political thing, a political statement, whether you wore a mask or not. We've got to get beyond that. This is not about politics. This is about public health and protecting each other, because we're all in it together. Everyone, globally, all countries, within our countries, every race, religion, ethnic group, we're all in it together, and we've got to pull together. That's really the message. That's the uniform message.
Yeah, and Dr. Fauci, can you talk a little bit about antibodies, and also whether or not someone who's had the coronavirus recovered, can they get it again?
Right. Good question, Stacey. The answer is, when you get infected with any virus, generally when you recover, you've recovered because your body has made a good immune response to clear the virus. We know that that happens with the SARS coronavirus 2 and people who've had COVID-19 illness. What we don't know yet is what the duration of that immunity is. In words, immunity is generally reflected by the level of what we call antibodies, which are proteins that the body makes to fight against and to neutralize the virus. There are varying levels of antibody in people who recover. What we're following is how long they last. And some people, interestingly, it doesn't last very long. But there are other types of immunity that go beyond antibodies, and they're called T-cell immunity or cellular immunity, which may also play a role in protecting people from being reinfected. So the bottom line is, there likely is a degree of protection, and it is likely pretty good protection for a finite period of time. We don't know exactly how long. The question you asked, Stacey, about getting people reinfected, there are no real well-documented cases of people who've actually been reinfected. There have been some stories anecdotally about people who've recovered and seem to have gotten infected, but we don't know that definitively. So right now, we keep an open mind. It may happen, but there's no really hard evidence that that is happening.
Yeah, and I know we have a few minutes left, and I'll cede to our president.
Yes.
Just one other thing, Dr. Fauci, school reopenings, your educated, obviously, opinion on whether or not young ones should be going back to school. Anyone should be going back to school right now.
Right. Okay, so that's a great question, and it's on everybody's mind, Stacey, particularly as we get into the summer and getting towards the actual real-time opening. So we start off with a fundamental principle, and then I will specifically get to your question. The fundamental principle is that we should try as best as we possibly can to get the children back to school, because we know of the negative consequences on the children. Psychologically, some children in some areas rely on schools for a healthy breakfast or a healthy lunch. Also, and again, psychologically, it's bad for them not to be in school. There's also the downstream, deleterious, unintended ripple effect consequences on the family, the mother and father, who may need to stop working to take care of the children at school. So we should try to keep them open. But having said that, there's a big however. And the however is paramount needs to be the safety, the health, and the welfare of the children, of the teachers, and of the families who might get exposed. So when you say, should we open the schools, Stacey, I would have to say, we live in a big country, and it's very heterogeneous with regard to the level of virus. So some areas of the country have levels of virus that's so low, you could open the schools with impunity. There are other areas of the country where the level is not very high, but it's just percolating enough to be concerned. You might, at the local level, make the decision that you're going to open the schools, but you're going to have some conditions. You're going to either alternate virtual versus in person, one day versus another, mornings, afternoons, wearing masks, outdoor a bit. We leave that to the ultimate decision locally. But then there are some areas where the rate of infection is so high that it would really not be prudent to open the school. So the bottom line answer is, although we need to try as a principle to get the children back to school, you don't want to endanger their health to do that. So you should make a local decision based on what's going on in the location where the school is.
Yeah, thank you for that. Dr. Chavis?
Thank you. So, Dr. Fauci, in our community, the majority of our brothers and sisters who live in our communities don't normally visit their doctors regularly. They go to the doctor when they feel sick. My question is about asymptomatic. There are people who feel that they don't have the symptoms, but they may have the virus. Can you give us a short definition of what is asymptomatic means in regard to COVID-19, so that people out there who may be spreading the virus because they don't know they have it?
Well, Dr. Chavis, that's a great question, and I'm glad that you asked it, because asymptomatic, truly, there are about 40 to 45% of the people who get infected, of the cases, have no symptoms and will never get any symptoms. They'll just get infected. The infection will be in them. They'll clear it, and they'll never know they're infected. There are those who are pre-symptomatic, namely, they don't have symptoms yet, but they will ultimately going to get it in a few days and be sick. So, since there's so much asymptomatic infection, and we know that asymptomatic people can spread the infection to someone else, we should do as a general principle, which is the underlying rationale for everyone wearing a mask, is that, as strange as this sounds, you should assume that you are infected. and that in order to protect others, you should be wearing a mask.
Mm-hmm.
So when I go outside, I'm assuming that I'm infected. And in order not to infect anybody else, I'm going to wear a mask. The mask might even protect me from getting infected from someone else. And it likely does. And there's good data to show that it does. But the main purpose is to make sure that when I'm walking around, I don't infect other people.
Thank you. And then lastly, the World Health Organization. Do you still work with the World Health Organization? You know, again, we hear news stories, some accurate, some not accurate, that the United States is disengaging as a matter of policy from the World Health Organization. The reason why I ask this is because we, the African American community, we have relatives in Africa, we have relatives in the Caribbean, even in Brazil, all over the diaspora. And there's conflicting global, you know, the pandemic is just not in the United States, it's a global pandemic. So my question is, what advice and counsel could you give us about how we should be in tune or listen to the information that's given out by the WHO? And then lastly, Russia just announced that they're going to have a vaccine in 2 weeks. Sounds incredible, but I wanted to ask you, because you are the authority on this, first on the WHO and then on the assertion by Russia.
Well, let's take Russia first. Well, that's, you know, we could have a vaccine tomorrow. We wouldn't be safe or effective, but we could have a vaccine tomorrow. But we want to prove that it's safe and effective. And that's the reason why we're doing the clinical trial. So anybody could say they have a vaccine and make it, but you have to prove that it's safe and effective, which I doubt that they've shown that. But, you know, we'll see. I don't know what that vaccine is, so I don't want to make too much of a comment on it. But be aware of people that say they have a vaccine now. WHO, I still work very closely with WHO. I'm on a weekly phone call with them. I have a memorandum of understanding with them that I've signed with Dr. Tedros, who's the Director General. We still interact very heavily with the WHO. My institute is a collaborating center with WHO, so we're all in with WHO.
Very good. Thank you.
Dr. Fauci, what obligation do local health departments have to help with protections for the citizens in their jurisdictions?
What obligations do the local
health departments have?
Oh, they have. That's their responsibility, Stacy. That's their responsibility. Yeah. I mean, that's the way the health systems work. You know, the CDC is the central federal organization. They interact very closely with the state and territorial health officials and the officials at the city and county level. It's all part of a big team, and we're all responsible to the American public.
Well, Dr. Chambers, there's no way we can let Dr. Fauci leave. I know he has to go to the White House, but there's no way we can let him leave without mentioning another record that he has set that I'm sure a week ago he probably would not have considered it. But the Topps trading cards on sale for just 24 hours, Dr. Fauci's Topps trading card generated an all-time high print run record, clocking in at 51,512 cards sold. And it wasn't because he threw a strike to home plate.
That is for sure, Stacy. It had nothing to do with that pitch.
Well, once again, as we wind down, Dr. Fauci, thank you again on behalf of the National Newspaper Publishers Association, our chair, Karen Carter Richards, and our whole board, all of our publishers around the country. We thank you for your leadership. We thank you for taking this time with the Black Press of America. And we would like to reserve the right to come back in a few months just to assess where we are on this journey. I think that we were the first to declare a state of emergency in Black America back in the end of February and 1st of March, because we saw what was happening. But I would say that we are making progress, but I wish we could be making more progress. I'm thinking about over 150,000 Americans have died as a result of COVID-19 as of today. And we want to try to save more lives. We want to try to prevent more infections, try to get a check on this spread. So if there's anything that we can do in the Black press, working with NIH and working with you, Dr. Fauci, please let us know. We want to be engaged, and we want to be your partner in getting out the right information in a timely fashion to all people.
Thank you very much, Dr. Travis. Yes, I'd be happy to come back and chat with you again at an appropriate time. It was a pleasure being with you. Thank you, Stacy. Thank you both. And it's really been good with you. Thank you for having me.
Thank you. God bless.
Dr. Anthony Fauci, everyone. Thanks, and stay safe and stay well.